Hello and welcome to our video on back pain. This video entails all those causes which are A. urgent and B. spinal in nature, hence the urgent spinal causes of back pain, which obviously need to be addressed to and treated as fast as possible. So let's get right to it. Our first condition in this series of causes of back pain is malignant spinal cord compression. As the name suggests, it contains or it is to do with all those causes of metastasized tumors to the back or to the spine, vertebral column, which impinge on the spinal cord and cause features of cord compression like sensory motor deficit and bowel and bladder dysfunction. And obviously, the most common tumors to do with this kind of malignant spinal cord compression are breast cancer, lung cancer, and prostate cancer. And these are the ones which are commonly seen in literature. Of course, there are other tumors which do have decent mention. These are the ones that I wanted to talk about. The next two causes need to be studied together. This is cauda equina syndrome and conus medullaris syndrome. And we do study them together to understand the subtleties in these conditions. Conus medullaris syndrome is basically compression of the conus of the spinal cord, the end of the spinal cord, and hence it's a symmetrical paralysis because it's bilaterally compressed. Whatever is compressing the spinal cord has been bilaterally compressed. And on the other hand, cauda equina syndrome is compression of the nerve fibers, the horse tail nerve fibers that the spinal cord ends with, and hence need not be bilateral necessarily. So the obvious difference between the two is an asymmetrical paralysis in cauda equina syndrome and a symmetrical paralysis in conus medullaris syndrome. What's common between the two is that there is a significant amount of urinary retention that these conditions present with. So they present with neurological deficit, back pain, and acute urinary retention. The next cause that we will be talking about is an unstable vertebral fracture, and this presents with local pain on pressure. Usually vertebral fractures are seen in patients who are either osteoporotic or are on any kind of treatment like steroids, and they are of two kinds. They could be stable and unstable. Unstable vertebral fractures are the ones which are causing spinal cord compression and hence neurological deficit and need to be addressed to as fast as possible. This is a picture showing you vertebral fracture along with a demarcated area showing spinal cord compression. An epidural hematoma is another condition which can cause effective spinal cord compression. Two causes, vertebral osteomyelitis and epidural abscess, again cause a significant amount of spinal cord compression if it progresses to that stage. Vertebral osteomyelitis uncontrolled can lead to abscess formation like shown in the picture alongside. Vertebral osteomyelitis will present with fever and insidious pain, and epidural abscesses will present with fever with rigor and point tenderness at the point of abscess collection. So having said that, these are the 7 conditions that are present in literature which show an urgent spinal cord compression that present with back pain and need to be addressed as quickly as possible. Having said that, each of these conditions has a best next treatment, and since we need to work fast, the best modality of treatment is an MRI with and without contrast. Notwithstanding the fact that unstable vertebral fractures are better imaged with a lateral and AP view X-ray. But for most of these conditions, if you get an MRI with and without contrast, you should be able to delineate the compression and work fast. So for each of these conditions, we have a set treatment modality along with, of course, the others. So with malignant spinal cord compression, it is imperative that you urgently start IV steroids to reduce the compression. With cauda equina syndrome and conus medullaris syndrome, to treat the symptomatic urinary retention, we catheterize the patient. For unstable vertebral fracture, the patient needs to undergo a surgical spondylolisthesis. Epidural hematomas and abscesses can and must be drained surgically vertebral osteomyelitis is treated with antibiotics. Of course, having done all of this, it is imperative to get an urgent neurosurgical evaluation and undergo surgical decompression for all of these causes. So this is in totality the causes which cause urgent spinal back pain, and yeah, that's about it. Thank you so much.